Welcome to a short presentation. I'm with Stephanie Bamford and we're Central Consultancy and Training. My name's Kate Goodall, I'm a business manager, and I'm here to talk to Stephanie. She's just done a day of governance compliance training with some company secretaries, and I've come to catch her at the end of the day just to talk to her a bit about health and safety for board members. So Stephanie's going to talk to us about some essential health and safety principles.
Thank you, Kate. I think the first thing to say is that protecting the health and safety of employees and indeed members of the public, your contractors, anybody who may be affected by your activities is an essential part of risk management. It must be led by the board. I think failure to include health and safety as a key business risk in board decisions can have serious repercussions. Many high-profile health and safety breaches over the years can be traced back to failures in board leadership. Health and safety law places duties on organisations and employers, and directors of registered providers can be personally liable when these duties are breached. Members of the board have collective and individual responsibility for health and safety. I think for board members, you need to be clearly in the lead and in control in promoting health and safety and meeting your legal obligations. There are a few essential health and safety principles, the first of which is strong and active leadership from the top. You need to be seen to providing leadership from the board. You need to be seen to establish those effective communication systems from the board down, but also listening to what employees have to say. Employee involvement is really important. Engaging employees in the promotion, embedding a health and safety culture in the organisation, and of course providing training. Identifying risks, the assessment and review of health and safety risks. The fact that you must be taking competent health and safety advice, that you're monitoring, reporting, that you're reviewing health and safety performance. That all needs to be seen to be coming from the board.
Okay. And what would you say would be the benefits, Stephanie, of a positive and constructive approach to health and safety?
There can be all sorts of benefits, and they're quite wide-ranging. You're reducing the overall level of risk that you're exposing the organisation to. A positive health and safety culture can be seen to reduce costs. If you're managing health and safety, if you're reducing accidents, if you're reducing employee stress levels, employee anxiety, you can reduce employee absence from work. You can reduce turnover rates. You can reduce the number of accidents. The threat of any legal action to the organisation can be reduced. And if you've got that positive reputation for corporate health and safety responsibility with your stakeholders, you've got the respect of the people you work with, and hopefully a healthier, happier and more motivated workforce.
Okay, thanks for that. Stephanie, do you think that all board members are aware that they have statutory responsibilities?
I would say definitely not.
Okay.
There are legal responsibilities. For example, the board collectively is the employer, and board members do have individual and collective legal responsibilities, and health and safety law, the Health and Safety at Work Act, is very clear, and there are things that you must do to comply with the law. You must have, if you employ more than 5 people, you must have a written health and safety policy. You must assess the risks to employees, customers, partners in service delivery, anybody who can be affected by your activities. You must have effective planning, organisation control, monitoring and review of preventive and protective measures. The board has to see and be demonstrably aware of health and safety in the organisation. Competent health and safety advice, that can either be somebody who's an employee, or what a lot of housing associations do is that they employ external people to come in and provide that competent advice. You must ensure that your employees are aware of risks, that you've consulted them that they are aware of their responsibilities as well, because this isn't just the board. Employees also have a responsibility around their own health and safety and the health and safety of those working around them. If you don't comply with statutory requirements, there can be serious implications. Sanctions can include fines, imprisonment, director disqualification.
Okay, thanks for that. We've been talking about the health and safety legislation that's in place, but since 2008 there's been a corporate manslaughter offence. So can you tell us a bit more about the corporate manslaughter side of things?
Corporate manslaughter is a relatively new offence, and it is an offence that an organisation can be found guilty of. It's an offence that identifies gross failures in systems and procedures. So if the courts are looking at an offence of corporate manslaughter, what they're looking at is management systems and practices. And gross breach, which is the offence, is where conduct falls far below what can be reasonably expected of the organisation in the circumstances. But what board members need to be aware of is the maximum penalty for corporate manslaughter breaches is an unlimited fine. And additionally, the court can make a mandatory publicity order, and the organisation is responsible for publicising the details of its own offences and the fine.
Okay, that's very interesting. Okay. Have you got any examples of health and safety oversight when it goes wrong?
I have, and I think what boards need to be aware of in what I'm going to show you now is Inside Housing likes nothing better than a double-page spread on a health and safety failure. If you look at this one, earlier this year, 5 years ago, 2 women died after a fire in a block of flats. In January this year, a social landlord was fined for failing to carry out risk assessments in that building. And that's not the only one. We have HCA investigations on a regular basis around fire safety, around gas safety. The most frequent failure of a consumer standard, which results in a governance downgrade, is a failure to comply with gas safety regulations. There have been a number of regulatory downgrades. In January this year, an Almo was fined £40,000 for fire safety failures. Other housing associations have been fined where deaths have resulted as a result of failures in health and safety, risk management. I think that board members need to be aware that these things are happening, and they're happening in the sector.
Okay. Thank you very much for that, Stephanie. And if you've got any questions, please don't hesitate to let us know.
Pleasure. Thank you, Kate.
Thanks, Stephanie.